I am a midwife from UHCW, and my role is, as you can see there on the screen, I am the Perinatal Parenting Support and Education Programme Development Midwife. That is a mouthful. Basically, what that means is that I provide antenatal classes to expectant families who are booked with us under UHCW, and that's across Coventry and Warwickshire. Hopefully that's what you're expecting. Like I said, if it's not, then please feel free to hang about. That's absolutely fine. But this information is specific to Coventry, because that's obviously the trust who I work for. As I mentioned, if you have any questions, please do feel free to pop them into the chat. There is no silly question. This is a safe space. Whatever we talk about today will stay amongst ourselves, and hopefully we can all be respectful of one another. If you want to share your stories, or like I said, if you have any questions that you want to ask, I'm totally up for open conversations, so do let me know if there's anything that I can assist you with as we work through the presentation. So we'll get started. So in Coventry, we have around 6,000 births a year. That's quite a lot of babies. We are one of the largest units in the West Midlands, alongside Heartlands over in Birmingham. And it's quite a big unit, isn't it? We can appreciate it can be a little bit intimidating, even just looking at the building. We are situated over in the west wing of the hospital. We are spread over 2 floors. So we have our own entrance. You might have seen it, or you will have seen it. It looks like a spaceship. You walk through there into maternity reception, and we always ask that you check into maternity reception every time you visit the hospital, whether that's for a scan, whether that's to actually come to triage if you're in labour. Check in with the maternity reception first, and then make your way to the area of the department that you need to get to. Hopefully you know where that is. If you do get stuck, just ask anybody, ask a member of staff who will direct you where you need to go, or alternatively, just look up. We are signposted quite well in the hospital, so it should be able to get you where you need to be quite relatively smoothly. But as I said, it can be quite an intimidating place to walk into. I myself have 3 children. I had 2 of them in Coventry and 1 in a different local maternity unit, so I can completely appreciate how you feel coming in. I remember feeling very much, is everything going to be okay? What's going to happen? Is this going to be embarrassing? Is my baby going to be okay? Is this going to hurt? Those sorts of things. These are normal feelings, thoughts and feelings when coming into the hospital, whether that be for scans, it might be antenatal clinic, it might be, when you're in labour, or even if you're coming in, family and friends are visiting on the postnatal ward. It's a big department. So we just like to show you around. You get a sense of feeling for the maternity unit itself, and hopefully then become a little bit more familiar with the different areas within the unit too. So this is our virtual tour. Now, I have sent you an email with a document attached to it, and there's hyperlinks on that email and the document there. Those are links directly to the videos that I'm going to use this week and next week. So if for any reason the videos aren't working for you, and sometimes that happens, then you can actually refer back to that document and click on the link, and it will take you directly to the video. It should be in order. Fingers crossed it should be in order. But that's what that email was about at the before the session started. So do refer back to that. And if anyone's watching this on the pre-recorded session, then the videos don't show, as we play them in real time. So those people would need to actually use that document to actually access those videos. So that's what that's all about. So I'm going to show you around the unit. Like I said, give you a sense of feeling for the unit and show you the different departments. So when you come in to have your baby, you kind of hopefully will feel a little bit more familiar with the area itself. Okay, here we go. There you are. So, like I said, that is the unit itself. Like I said, very big, but really, really nice unit. But yeah, can be intimidating. But hopefully, that gives you a bit of a feel for what to expect and what the different areas within the department looks like. And as I said, if you do get lost, you just ask anybody wearing uniform, and we will show you where you need to be. So, the role of the birthing partner. For those of you that don't know what the birthing partner is and what essentially they're there to do, this hopefully will help to explain that. So in Coventry, you can have two birthing partners with you on labour ward. On Lucena, the low risk birthing unit, you can technically have as many people as you like, and the same as if you were at home as well. But what we ask you to do is just try to be sensible when thinking about actually having surplus birthing partners on the low risk unit or at home. Reason being, some women, especially if it's their first baby, they don't know really how they're going to react and feel during labour. And what might seem like a really good idea now to have like 10 people in that room, when you're in labour, you might change your mind and say, actually, I would rather it just be me and my partner, or me and my friend, or me and my mum, or me and my sister. There is no right and there is no wrong in that sense, but it's about what is comfortable for you. Okay, it is a really personal decision who you choose to have as a birthing partner. Also, thinking about surplus birthing partners, maternity is quite a fast-paced environment. Things can change quite quickly, and as a midwife, it is our job to keep you and your baby safe. Sometimes things will change, and we might have to deviate away from your birthing plan. Obviously, that's always going to be a discussion. We will, always keep you informed, and everything is always going to be your choice. Like I said, we are there to advise you, but ultimately, everything is your decision. But there might be times where we need to physically get to you, to mum, and to baby or to baby quite quickly. And if we've got loads of people surround you around that bed, it can be a little bit difficult. Every second really does count, and like I said, we need to keep you guys safe. So do be sensible when thinking about having extra birthing partners. But if you really did want a few extra people, that is absolutely fine on Lucena. But as I said, on labour ward, we allow two people. And those two people need to remain the same two people. You can't swap and change. Okay. So the majority of our ladies, they will have their partner. For those that don't have a partner, it may be that you have your mum, your sister, a friend, a neighbour, if you're really close with your neighbour. It is whoever is important to you, whoever you feel comfortable having there to support you, because they are basically going to act like your rock during labour, the shoulder to lean on physically and emotionally, and you want somebody who's going to be there to support you. So when we speak to those 6,000 women, because believe it or not, we do talk to you guys, and we talk about what went well with regards to their birthing partner, what they expected, how it worked for them, maybe things that didn't work so well for them. These tend to be the main themes that come up in conversation. So ideally, we want somebody who's flexible. Now, we're not talking about, in gymnastics, we're not asking them to be doing cartwheels around the room or anything like that. We're talking about with their time. We want your birthing partners to essentially be on call for you. Now, when you go into labour spontaneously or naturally, that can really happen at any moment. You never know really when you're going to go into full-blown labour. And that's when we need your birthing partners to be ready to go as well. Okay, so we want phones on loud, bosses aware that, partners are about to have a baby soon, no work trips, lads' holidays, golfing trips, all those lovely things, especially as it's getting nice and warm outside. Please try to refrain from booking weekends away with your mates. Be here and be present, phone on loud and ready to go. Okay, we want somebody who's able to listen to you, who's confident, encourages you, motivates you, and can advocate for you. What we mean by that is we want them to be able to communicate openly and effectively with us, the staff. Okay, when you are in labour, you will be assigned a midwife. You will have one-to-one care. Obviously, if our shift changes, then you'll have a different midwife take over. But essentially, you have one midwife in the room with you. It might be that we have a student with us as well, if you feel comfortable having students with us. But really, that's the only sort of professionals that are in the room when you're in labour. And we are strangers to you. When you come in, we are strangers. We will have information with regards to yourself and your pregnancy, from what we can see on the screen in front of us, from documentation throughout pregnancy that the midwives or doctors may have written on your notes. But we don't know you as people, and we only know as much as what you choose to share with us. So it's really important that we do have open and honest communication, so we can facilitate a birth that you have envisioned. Okay, so what we want you to do is think about writing a birthing plan. Now, I think when you fall pregnant, you find out you get those 2 lines on the pregnancy test, we all automatically start to think about what might happen, what this might mean. You think forward. I definitely did with mine. I sort of started to think, okay, well, I'm going to have a baby, so like, what might that look like actually giving birth? And we do it subconsciously, and then we also definitely think about it throughout pregnancy. But essentially, this is how we're going to start collating information to write a birthing plan. A birthing plan is a physical document that you bring into the hospital with you and hand it over to your midwife. Now, it's never too early to start writing a birthing plan. Ideally, we would like you to have your choices, your options sort of written down and ready to go around 36 weeks of pregnancy. And your midwives in the community should be having conversations with you at your 36-week appointment and discussing your birthing plan with you as well. But just in case for any reason that doesn't happen, or if you want to just get started, like I said, it's never too early to start thinking about your birthing choices and your birthing plans, and you're not quite sure how to do that, what that looks like. If you literally just Google NHS birthing plan, it will come up with a template that's going to give you questions and information and get you thinking about what you might need to be thinking about with regards to your birthing choices. Okay, it will help lead the way for the discussion, and the things that you probably haven't even thought about will be on there. Knowledge really is power. We want you to come in feeling confident with your choices, and we want you to go home feeling empowered about your birth. Okay, you guys really are in control of everything. The midwives, the doctors, we won't even touch you without your permission. So do think about what your birthing choices are. Do loads and loads of reading. Don't let this be the only thing that you do with regards to antenatal education. This hopefully will be a bit of a foundation, a starting stone, or starting block. We want you to go away, read about things, talk to your friends, talk to your family, talk to your caregivers about everything birth related, and that will then help you to write your birthing plan and allow you to have conversations that will hopefully open up discussions and topics that, like I said, you might not even have thought about, but they are always really important. Okay, and there's never anything silly that you can write on a birthing plan, and the more information you can put on your birthing plan, the better, because that will help to guide us. Now, when you come into hospital, or if you're at home, we will take the birthing plan off you and we will discuss that with you. We will have a conversation, and we will do our best to to follow that birthing plan as much as possible, again, as long as it's safe for mum and for baby. But it's really important that when you are writing your birthing plan, again, you are being realistic about your choices, and we want you to think about sort of what might happen, if you were if something happened and we had to maybe suggest intervention, things like an instrumental delivery, or if we needed to go for cesarean section, how would you feel about that? What would you prefer? We want you to think about these things now whilst you're still pregnant, so you have a better idea and understanding of what could potentially happen, and then how you would feel about that. Because if you're in the moment and these things crop up, it can feel quite intimidating. And the last thing we want you to do is go home and think that wasn't really the birth that I wanted, because you felt like you were sort of put on the spot. There's a lot of pressure there involved. We want you to sort of have an idea in your head now, so that if it does happen when you're in labour, you feel confident and feel happy with those choices. We want you to include your birthing partner when thinking about your birthing choices and writing a birthing plan, so they can be on board with it too. And then they can hopefully communicate that with us as well. Okay. Now, it's quite common for women when they are in labour to be so focused on being in labour and birthing their baby that you might not want us to speak to you, the midwives to speak to you. You might not hear what the midwive's saying to you. You're so focused in the zone that actually everything else just becomes sort of background noise. And in those instances, your birthing partner then, because they will know what's on your birthing plan and what your wishes are, they can step forward, tell us what's on your birthing plan, and then hopefully we can work together to facilitate that positive birth that you so want. And that's exactly what we want you to do. We want you to go home, feel happy with your choices, feel happy with how things have gone, and obviously then everyone's happy, and it makes for a better, happier mum, happier baby, and overall better experience. We want somebody who's prepared for every eventuality. So your hard do's and your hard don'ts in labour. So what we mean by that is things you can control and things you can't control. Okay, things you can control are the things that you can bring into the hospital with you, and the things that you can sort of make do in that room itself. Now, in the video you probably saw the rooms themselves. They're very clinical. You're in hospital. They're white. They're not the most welcoming or inviting, because we're in a hospital. But actually, you can bring things in from home to make that room a little bit more comfortable for yourselves. So if you have a pregnancy pillow that you like, bring it in with you, or just a general pillow from home that you like, bring that in with you. That's fine. If you have a comforter or a blanket or something like that at home, bring that in with you. That's also fine. If you wanted to bring in pictures from home, or if you have the children or just friends and family, dot those around the room, That's fine. Obviously, we can't be like hammering things into the walls and stuff like that. But if you wanted to print things off and put them in photo frames, bring them in, please do. Okay. We have Starlight projectors on Labour Ward. So they are projectors that we literally plug into the wall and they project stars onto the ceiling. We can dim the lights down and it just makes a really nice atmosphere in the room. Or if you wanted to bring something like that in with yourselves, that again is absolutely fine. We have stereos in all of our rooms, including in theatre as well. Those stereos you can connect to any smart device too using the Bluetooth. So if you wanted to make a playlist or you want to bring in a podcast or an audiobook that you're listening to, if you're thinking about hypnobirthing and you want to bring in the music for that, totally fine. Bring in a smart device, have all that stuff downloaded on there, and then we can connect it to the stereos and you can make use of that technology in the room as well. These are things that we would actually actively encourage you to do because it's going to help you feel more relaxed, help you feel more at home, and again it will hopefully help to facilitate a more positive environment for you guys to help you feel more calm in that room, and that's what we want during your labour. Okay, and also your birthing partners can get involved with that too. They can sort of play DJ, which is quite nice, a little job for your birthing partner to do. The things we can't control in labour, as I've already touched on, are the things that your baby's going to do. So your baby ultimately will lead the way. We have to keep a close eye on them. We will monitor you throughout your labour to make sure that baby is coping well, and also we will do observations on yourselves as well quite regularly. So if you feel that there is a change in yourself or in your labour, in your baby, say baby's movements or anything like that, you just let us know as soon as possible so we can then obviously do our assessments maybe a little bit quicker or a little bit sooner, or just so we can be aware of that, so we're keeping you and your baby safe as well. We want your birthing partner to be aware of that as well, so that should things have to deviate slightly from your birthing plan, everybody's sort of on the same page. Thinking about your birthing choices, if you go onto our maternity website, there is there's a tab in our menu, and the menu of it, can't say it properly. There's a tab on the menu on the website, which actually is all about birth choices. I would actively encourage you to check that out. It's going to help, again, along with your birthing plan, allow you to sort of explore sort of what your birth choices are, and hopefully give you some information if you're not quite sure what to expect or what your choices really can be or might potentially be. Check out that on the website, and it will hopefully help to sort of answer any questions you might have with regards to your birth choices. We want your birthing partner to provide you with emotional, practical, and physical support. So labour is called labour for a reason. It's not really how it's portrayed on TV. If you watch things like One Born Every Minute, for example, that's all been very edited, for entertainment purposes. Try not to watch those things or put too much premise on those things. Labour is called labour for a reason. It is labour intensive and it tends to be a bit of a journey. So please don't be disheartened if things are taking a little bit of time. That is normal, and everyone is different as well. Okay, what we would really ask you to do as well is try to stay away from things like TikTok and Instagram. We've seen so much stuff circulating online on social media, and these are all people's personal experiences, supposedly, but also their own opinions. A lot of the things that people post on social media, again, are for entertainment purposes. They're not actually factual based information. So do try to seek out information from the proper sources. Speak to your caregiver, speak to the midwife, speak to the doctors, look up actually, relevant information from credible sources, especially with regards to labour and birth. Try not to listen too much to what people have to say around you, because it's entertainment, isn't it, really? It's a bit exciting for people to share these stories, but the last thing we want you to do is listen to those stories and then become scared, or fear mongering. We're trying to obviously step away from that. So then we also want your birthing partner to provide you with company, some gentle distraction, and just generally be there for you. Like I said, it is a personal choice and it's your choice to make. As long as you feel comfortable with that person being your birthing partner and they feel comfortable being your birthing partner, we are more than happy for you to choose whoever you want to choose. But obviously we have to make sure that everyone is safe. So like I said, on labour ward, 2 people, the same 2 people. On Lucina, we are slightly more flexible, but ideally not lots of people, but you can have a few more than just the 2. So hopefully that's helped to explain what the birthing partner does, what their role is. They really can be as involved as they want to be, or not involved at all. That's fine. If they want to sit in the corner and eat biscuits, that's totally fine. It's what works for you, and like I said, it is a personal choice. So let them know what your wishes are, let them know how involved you want them to be, and just make sure that they feel comfortable doing that as well. Fab. So on to labour and birth. Believe it or not, we do actually split labour up into 3 different stages. Now, that's not to say that once you go through one stage, you're hanging around for the second stage. Like, it's a continuous thing once you are in labour. But essentially, we split it up into the first, second, and third stage of labour, as hopefully you can see there on the screen. So, the first stage of labour is when your cervix starts to dilate. So your baby is inside of your tummy, obviously, inside of the uterus. The exit of the uterus is the cervix. And when you're not in labour, your cervix is around 2 centimetres in length. It's firm, it's long, it's hard, and it's closed, okay? And it actually points towards your back. Your baby won't come out like that. So your body has to make some changes, okay? During early labour, your cervix will start to shorten, to soften, and then it will start to open up. When you reach 4 centimetres of dilation, so your cervix is opened up to around 4 centimetres, that's when we class you as being in the first stage of labour, okay? Your cervix then will continue to open up and eventually we'll get to 10 centimetres of dilation, open to 10 centimetres, and that's your first stage of labour, okay? Once your cervix is 10 centimetres, we then class you as being in the second stage of labour. And this is when you will get involuntary urges. So you will automatically just start to bear down, to feel like you need to go to the toilet. It feels like you just need to push. Your body will just do it. It will override everything, and your body will just start to push. This is your second stage of labour, when you birth your baby. And it's the bit that people focus on the most because, you know, obviously you're birthing a baby and that's exciting. But for a lot of women, they feel a little bit scared. They might feel a bit nervous, a bit anxious. And that's fine. It's normal to feel that way. But we will work with you to help you birth your baby. And once your little one is out, the second stage is done. Then we move into the third stage of labour, and this is when you birth your placenta. Now, your placenta is a pregnancy organ. You have a brand new one of these with every pregnancy, with every baby, and it's really important that it comes out. Your placenta is basically stuck onto the uterus. There's like blood vessels that are sort of entwined between between your uterine wall and then the placenta itself, and that's how it gets its blood flow. So mum's blood will come up to one side, an exchange will take place between the two, and that blood is then filtered out through the placenta, and then that good blood with everything that baby needs to grow and to thrive inside of you, all of the oxygen, all of the nutrients that baby needs, is then transferred to the baby via the umbilical cord, and then baby circulates that blood, and that's how they breathe and they eat inside of you, because at the minute they're in a sort of like a balloon full of water. That's called the amniotic sac, and the water is called amniotic fluid. And it's really important that placenta comes out. What happens after you have your baby is your contractions will then actually start to come back. Initially, they'll slow down. Sometimes they just stop, but they will then start to come back a little bit. And you might be thinking, what on earth is going on here? And that's because your uterus, will start to contract. So what it does really is it sort of shuts down the blood vessels and causes the placenta to fall away from the uterine wall. What's left behind there on the uterus, on the uterine wall, is an open wound, and it will start to bleed immediately. You have about 500 mils of blood that passes through the uterus, every minute. So that is a lot of blood every minute. So it might look a little bit alarming, but we expect there to be a little bit of a bleed after baby's born, and that's when we can sort of assume that your placenta has come away from the uterine wall. What happens is you will then feel the urge to push and you will birth the placenta. Now, it's not like birthing a baby. There are no bones in there. It's soft and it's squishy. And once the placenta comes out, you get like an automatic relief. The contractions stop. You have your tea and your toast and everything's great again, okay? When the placenta comes out, the uterus, though, it will continue to contract a little bit. It's not like contracting like you're in labour, but you will get sort of like period type pains, and that's because it will get smaller and smaller and smaller. When it's contracting, it's becoming small again, and ideally the placenta's trying to sort of shrink in size back to pre-pregnancy state. Once it needs to get back down below the pubic bone. Okay, what it does when it's contracting is it's clamping down on those open blood vessels, and it's basically stopping itself from bleeding. So it's really important that your placenta comes out so it can do that. If it doesn't come out or anything's left behind, then obviously your risk of bleeding is then higher. And actually, if you do experience a postpartum bleed, one of the first things the doctors will ask the midwives is, well, is the placenta out? Yes. And what we do is, as a midwife, once the placenta is born, we check it. We open it up, we have a look at it, we make sure that everything looks like everything's complete. If any part of the placenta is left behind, again, you're going to be at a higher risk of potentially bleeding after you've had your baby, and also infection, because the placenta now has no blood flow and it is human tissue. So what it will do is essentially it will start to rot and then you will develop an infection. So that's why it's really important that the placenta comes out. Now, once it does come out, you can do with it whatever you want to, really. It is your human tissue. So if you wanted to take it home with you, that's absolutely fine. We just ask if you bring in like a Tupperware box or something like that with a lid so you can transport it home, safely. And also because it's a little bit messy as well. You don't want it to be going anywhere. And so ideally like a Tupperware box with a lid on it, and then we can keep it in the fridge if you want us to, or you can keep it with you until you go home. Some people like to plant it when they get home. Some people like to cook it and eat it when they go home. Everyone is different. There are different cultural beliefs with regards to the placenta, so it's your choice. The majority of women will leave it with them up into special bags. They are then transported to our mortuary in the hospital and they are incinerated. It's kind of like a cremation because, like I said, it is human tissue. So there are policies and there are legalities around that. We don't just throw them in the bin for the bin man to collect on a Monday morning. They are disposed of in a very respectful manner. Because, like I said, it is human tissue. So that's what we tend to do with them. But like I said, if you want to take it home with you, then you are more than welcome to do so. Now, that is basically like a whistle stop tour of what happens during labour and how those different stages, what happens during the different stages. But I have a little bit of help here. So this lady here, her name is Marley. She is a midwife herself, so this is credible information. And she's going to just explain those 3 stages of labour in a little bit more depth, just to give you a bit of a better understanding. Because if I was there in person with you, we could talk it through and we get the diagrams out, but obviously we're not. So I'm going to get the help of Marley to help me explain in a little bit more depth the stages of labour. And like I said, if you do have any questions, do feel free to pop them into the chat. But essentially, just remember, labour is different for everyone, and it's different every time you have a baby as well. So just because something might have happened in your first labour doesn't necessarily mean that it's going to mimic that in the second labour. It is a different process every time you have a baby. But again, it's just about being open with your communication, trusting of your caregivers, working together, and we will get you through that. But at any point, if you have any questions, do feel free to ask. Right, I'm going to stop talking. I'll show you the video. I'll put the captions on because sometimes this can be a little bit quiet, but I'll put the captions on so you can sort of see what she's saying as well. Okay, here we go. There we go. So hopefully that's given you a good understanding or oversight of what to expect for labour. But as she said, really, if you do have any questions, concerns, doubts, anything like that, even before you're in labour, if you're not quite sure, if you're in the early stages of labour, or anything happens at all, you just give us a call. We are there 24 hours a day, 7 days a week, and that includes the weekends, it includes holidays. We're always going to be there. So call triage if there's anything we can do for you prior. But yeah, that is what hopefully gives you a bit more of an understanding what to expect during labour. Now, we get asked quite a lot what happens when your waters break. Again, this is a very personal thing. There is no right, there is no wrong. We can't predict what's going to happen. For some women, their waters will break before they even go into labour. For some women, their waters will break whilst they're in labour. Sometimes we have to break waters for you, and sometimes babies are actually born in their amniotic sac. So the waters haven't broken, they're born actually, and that's all intact still, which is always quite exciting to see. But like I said, we can't predict what's going to happen. What we would ask you to do though, if your waters do break and you're not in labour, put a big thick maternity pad on and call triage. We will ask you a series of questions to assess you over the phone and then make a judgment whether we think it's appropriate for you to come in for a physical examination or assessment, or whether we can actually just give you advice over the phone. But put a big thick maternity pad on and keep an eye on those waters. What we will ask you will consist of the following. So think of the acronym COAT. So C, colour of the fluid, the colour. What colour is it? If it's your amniotic fluid, it should either be clear or it can be a very pale straw colour, like a very light yellow colour. It should not be brown, it should not be green, and there should not be bits floating around in it. If there is any of those things, that's a sign that baby's potentially had a poo inside of you. If the water's pink, that is a sign that you might be bleeding a little bit, and obviously bleeding in pregnancy is never, we don't like that to happen at all. So keep an eye on the colour of the fluid that's coming out. O, odour, what does it smell like? If it's your amniotic fluid, it should either smell of absolutely nothing, or sometimes it can have a very faint sweet smell to it. It's really difficult to try to explain it until you smell it. But if yours smells a little bit sweet, you'll understand what I'm talking about. It should not smell offensive. It should not smell off or weird or just like, oh, what is that? That's a sign of an infection. Okay, so keep an eye on the odour. A, the amount. How much has come out? Was there a lot? Was there a little bit? Has it stopped coming out, or is it still continuing to trickle out? If it's your amniotic fluid, it will continue to trickle out. And actually, when babies are born, they're usually born with a bit of a gush of water behind them. And that's because the water surrounds them, okay? It's not just sort of in one pocket, it's all around them. Essentially, what happens when your waters break is there's a hole in that sac. So you can see on the screen the baby's in that balloon of water there. Essentially what happens, or it means, is that there's a hole in there. So every time baby moves, a little bit more water will come out, and their limbs will generally act like a little bit of a plug. Okay, so every time they have a little bit of a wriggle, you'll find the water will come out a little bit. For some people, it's a continuous trickle, but for some people, it's like a little gush here and there. However, as baby gets bigger especially, or if you've had other children, your pelvic floor might not be what it once was. It's not uncommon for women to actually urinate, to pass urine, to wet themselves. And that's nothing to be embarrassed about. It's quite common. It's quite a normal thing to happen. But in that sense, if that is the case, then that pad that you've put on will be sort of dry when we assess you. If it's your waters, after about an hour or so, if you were to take the pad off, you could probably wring it and it would be sopping wet. Okay, so that's the difference with regards to the amount. And then T, please make a note of the time that it happened. If you aren't sure what time it happened, say for example you woke up in the middle of the night and you're all of a sudden like, hold on a minute, why am I lying in a pool of water? Just make a note of the time that you noticed there was a change or a difference. The reason being is when the waters are intact, okay, so the waters haven't broken, that is essentially a closed circuit. It's a sterile environment for baby. When your waters are broken, like I said, there's now a hole in that sac. So that's no longer sterile. And actually bacteria is able to develop and multiply and potentially can cause infections for both baby and for mummy as well. So what we ask is that you make a note of the time and try and be as sort of on point as possible, because we don't like to leave you for too long with your waters broken. What we would usually do is if you haven't gone into labour after 24 hours of your waters being confirmed as broken, we would usually invite you back into the hospital for an induction of labour process. Now, this is your choice. You can choose to say, I would rather wait a little bit longer, and then we can come up with a plan together. We'll ask the doctors to talk to you and review you, and then we come up with a plan to keep you and your baby safe, and so you feel happy with that plan. But usually we would encourage you to go forward with the induction of labour process, just because we don't want you or your baby to sort of develop any infections. We don't like to leave your waters broken for too long, because that risk obviously increases the longer your waters are broken. So that's essentially what happens when your waters break. Now, it's not painful for you when your waters break, and it's not painful for your baby. There are no nerve endings in the amniotic sac, so don't worry about that. And actually, if we have to intervene and break your waters, there's loads of different reasons why we might do that. And again, it would be a conversation that we have with you. And if you felt comfortable with us doing that during labour, then that's something that we could potentially do at some stage for, like I said, various reasons. But if we were to do that, it might be uncomfortable because it would require a vaginal examination, but the actual breaking of the water process itself is not painful because, as I said, there are no nerve endings in there. Actually, just to point out that it used to be more so that we would give it the 24 hours, but they're now increasingly offering the induction of labour process upon confirmation of your waters breaking. So if you are coming in for assessment to see if your waters are broken, please bring your hospital bag with you, because there is a chance that you might not be going home until you've had your baby, if that's something that you choose to accept. With regards to recommendations, again, this is a very personal thing, just as everything in maternity is, but as a blanket sort of rule of thumb, bring in your hospital bags just in case, and then that's a conversation for you to have with the doctors should this actual situation arise. But yeah, that's what we would ask you to do. So put a big thick maternity pad on, give us a call, think about these things, and also just point out, just because the colour's fine, doesn't smell off, it's just trickling a little bit, and you're within 24 hours, that's great. But that doesn't mean that things can't change. So keep a very close eye on the waters. And if at any point it does change, you just let us know straight away, and then we'll advise you what to do. Wonderful. So thinking about then positions during labour, your body will naturally go into positions that it feels most comfortable when you are in labour. But what we would recommend doing is actually practicing birthing positions now. Obviously, please don't overexert yourself. Be careful, especially as your baby gets bigger, your bump will get bigger, your center of gravity will change. Don't do anything that's going to harm yourself or your baby. Be careful. But we would recommend giving a few positions a go, just so you have an idea of what you might find comfortable. It might completely change during labour, but just so you have an understanding of the different kind of positions that you might want to adapt. And include your birthing partners in this as well, so they can support you with that. Say, for example, if you're a bit tired, you're thinking, I don't really know what to do anymore, your birthing partner can actually step in and say, well, you found it really comfortable on the birthing ball, or you found it really comfortable lying on your left-hand side. Those are the kind of things and encouragement that we would like your birthing partner to support you with, because again, they will know you better than us, and they can support you with this antenatally as well. Then when we move into the actual labour and birth, they're going to be there as your right-hand man, really, to support you with this, and can help sort of ground you a little bit and actually help you with these birthing positions too. So I'm going to show you a little video. It's only a couple of minutes long. Just going to give you a little bit more information with regards to birthing positions. Just to point out as well, we do have birthing balls in the hospital. You don't need to bring anything in with you. We also have birthing balls on the antenatal ward as well. So don't worry about lugging a big birthing ball into the hospital. We will provide those for you. Also, to point out that the beds in our hospital are also all electric, so we can actually manipulate those beds as well. We can raise the back of the bed up, we can lower the bottom of the bed down, we can use the stirrups, lithotomy as well, to support your legs and open up your pelvis if you feel that that would be more comfortable for you. There's so many things we can do with the beds. So don't feel like you have to lie on your bed on your back to birth your baby. You don't. We would actually encourage you to try and be as upright and as mobile as possible. But obviously there are things that can occur during labour that can potentially sort of hinder that. Say, for example, you're being monitored continuously. It might be that you won't be able to get up to walk around the bed as much as you would do if you didn't have continuous monitoring because of the wires and the cables. Or say, for example, you were to have an epidural. That means that you would basically be numb from the waist down, in which case it wouldn't be safe for you to get up off the bed. You won't be physically be able to get up or off the bed. But we can manipulate the bed using the, obviously because they're electronic, we can manipulate the beds to help facilitate a better birthing position. And so think about that when we watch this video, and hopefully it'll all sort of make sense. Okay, here we go. There we go. So what can we do then to support you and help you feel more relaxed during labour? Now, it's really important just to say, again, there is no right or wrong with regards to pain relief during labour. If you feel that you need pain relief, please feel free to take it. We don't want you to suffer. You're not going to be a martyr. Like, we want you just to feel comfortable. We want this to be a positive experience. So please do accept pain relief if you feel you need it, or ask for it if you feel you need it. Now, this is a small list of what we have available. There are a couple of other things, but the main things that we would suggest during labour with regards to pain relief are what you can see here on the screen. So I'll just go through the different pain relief options that we have available. So in terms of oral medication, the first thing we would do is offer you some tablets. So in maternity, hopefully you know you shouldn't take ibuprofen. So what we would offer you would be paracetamol and codeine. Now, paracetamol, when you're in labour, do you think it will do much? I'm hoping you're nodding. You're shaking your head, sorry. No, it won't do much during labour. But actually, during the early stages of labour, or even the induction of labour process, paracetamol and codeine together should help to sort of take the edge off things. In full-blown labour, I don't think it would be strong enough, but in those early stages, absolutely. And we will automatically go through a list with you, and the thing on the top of our list would be paracetamol and codeine, because we start from the mildest and then we work our way through to the strongest pain relief options. Okay, so just bear that in mind. We will offer you paracetamol and codeine. If you feel like it wouldn't be very beneficial to you, that's fine. Just ask us to move on to the next thing, but we will ask you, as a rule of thumb, which one would you prefer. So first thing, paracetamol and codeine. Then we move on to the injection. So this is pethidine, or we're actually using something called dihydromorphine actually now. They're essentially in the same family of pain relief options. They are both opiates. So what that means is they are a stronger pain relief option. They metabolize into morphine in the brain, and they are pretty effective, to be honest with you. Pethidine or dihydromorphine will start to work within 20 minutes. It's an injection that we give you into a muscle. So in maternity, we tend to give you injections into the muscle sort of at the top of your thigh, next to your bottom. That's sort of, I think it's the kindest area to do it, to be honest, but that's essentially where we would give you the injection. Now, if you've had opiates before, if you've had like codeine, or if you've had morphine before, you might realize that, or you might have experienced that it just can make you feel a little bit sick, can make you feel a bit drowsy, can just make you feel a bit like yucky, let's be honest. If it makes you feel a bit sick, we can actually give you an injection to hopefully counteract that. But for some women, they still get breakthrough sickness, which unfortunately there's not anything that we can do about that if you were to experience nausea and actual sickness when you have had pethidine or dihydromorphine. Because it makes you drowsy, we would just encourage you to fall asleep. Just go get some rest, sleep it off, and then within around 4 hours or so, 4 to 6 hours, it should hopefully then wear off. Okay, but like I said, for some women, unfortunately, they do still get that breakthrough sickness, even if we give the anti-sickness medication as well. This, though, passes over the placenta to baby. So if you feel drowsy, your baby will also feel quite drowsy. So for that reason, we would not recommend this medication when we are almost approaching the second stage of labour. Because if your baby is born drowsy, sometimes they don't necessarily take that first breath for themselves, and then we have to intervene. For an otherwise healthy baby, we don't want to have to do that. So we would recommend the injection, again, in the induction of labour process, or in the earlier stages of labour, during the first stage of labour, okay? Or the earlier part of the first stage of labour. Then we have something called TENS machine. So that's the picture of the little 4 pads on the lady's back. Now, we don't have these physically in the hospital, but you are more than welcome to bring them in with you. You can rent them from different companies around the area. You can even buy them yourselves as well. There are different types of TENS machines. Just make sure that you're buying ones that are suitable for human use, okay? I've seen things, or some of them on like Amazon and stuff like that, for like £10. I don't know how effective they would be during labour. For me, if I was going to go buy a TENS machine, I would go to like Boots or somewhere like that, and actually discuss it with the staff members in store, even discuss it with the pharmacist, and ask them for their advice. Make sure it is suitable for you to use when you're pregnant during labour, and that is obviously, yeah, for human use as well. Because like I said, you can get all these different things on different websites, eBay and stuff, TikTok shop, you know, and actually they're not regulated, and it might just be a waste of money. So don't waste your money. Go to places, actual shops, speak to the staff members. Ideally, if you are going to like a Boots or something like that, like I said, do speak to like the pharmacist, and they'll be able to give you advice, and make sure that you're choosing the one that will work the most effective and safely for you, or safest for you. Then, so the TENS machine, I haven't actually told you what it does. So what those are 4 little sticky pads, and the wires, as you can see coming off there, they are attached to a machine that mum will hold, you will hold yourself. And essentially what happens is when you get a contraction, you press a button and it will emit electric pulses into the back. Those electric pulses will block off nerve endings, and that's how it helps with pain relief. Again, this is really effective in the induction of labour phase. It's really really useful, really effective in the first stages of labour. As we approach birthing baby, it probably won't be as effective, but for a non-medicated pain relief option, this is really positive. And you can use this in conjunction with everything else except water. Obviously, electric and water, they don't mix. So you can't use this if you're going to be in the pool, for example. But everything else, that's absolutely fine. You can use this with anything else. And as I said, it's non-medicated as well. There's no medication actually involved or drugs involved there. It's quite a natural pain relief option, and definitely worth looking into if you haven't already heard of it or you haven't looked into it at all as well. So definitely have a look into that one. Then we have the picture there with the lady breathing something in. So that is Gassanair, otherwise known as Entonox. And this actually is our favourite pain relief option. The midwives, we will offer this one to you sort of as soon as you arrive. And it's, again, it's a really good pain relief option itself. It's plumbed into all of our rooms on labour ward, so you're never going to run out of it. That's positive. And we also have canisters of it upstairs on the antenatal ward, and we also have canisters of it downstairs. So if we need to transfer you to a different area within the department, we can take that with us. We don't just sort of leave you. You know, we do transfer you, make sure that you are comfortable during that transfer. Okay, so what it is it's a handheld device that, like I said, it's plumbed into the room, and it's the plumbing itself, like it's like a big tube, and we attach it to the handheld device. It's a mouthpiece, and we will ask you to breathe it in slowly and rhythmically. Okay, so it's really good when thinking about relaxing your body and helping you to slow your breathing down, because you have to breathe it sort of, you can't be chugging away on it because it won't work. Okay, it'll just make you feel really lightheaded. But the way it does make you feel is a little bit woozy, can make you feel a little bit dizzy, can make you feel a little bit drunk. Okay, when you breathe that gas in, it will start to work within 30 seconds. And if you don't like the feeling that it gives you, you just breathe in normal air, and within 30 seconds, you're then back in the room. So it's fast acting, but it also wears off really quickly as well. Some women, it can make them feel quite sick as well, quite nauseous, and also can give you a bit of a dry mouth. So we would encourage you, obviously, in between using the Gassanair to sip on some water. And again, if you did feel quite sick with it, we would just say, do you know what? Breathe normal air, let it wear off, and then see how you feel. And if we then need to explore other pain relief options, then we absolutely can do so. I will say the majority of ladies in our care, they tend to use the Gassanair, and that's all they use. But again, you can use this with everything else as well. There is no limitations here. You can use this with anything else. The particles in the gas itself are quite large, obviously not to the naked eye, but in terms of like, you know, chemicals and stuff like that, and actual molecules, I should say, not chemicals, they will not pass over the placenta to baby. So this doesn't affect baby in any way either. And as I said, it is an effective pain relief option. It doesn't take away the pain, but it will definitely help distract you from the pain. And if you've ever broken a bone or anything like that, you've been in an ambulance, this is what the paramedics use for pain relief options for people that have broken bones and stuff like that on the transfer into hospital. So you might have already tried it. Saying that, this is just for mums, okay? If the midwives catch birthing partners using the Gassanair, they will not be happy, and you will get told off. So just be aware, from me to you, the midwives will not be happy if birthing partners are found using the Gassanair. So just be aware of that one as well. Then we'll go on to the picture of the pool. If you can see that in the top left-hand side there. So that is a water birth. That is a pool birth. And you might be thinking, water, pain relief? I definitely used to think water and pain relief, they don't belong in the same sentence. But actually, it's such an effective pain relief option. Again, this is natural. It's just warm water. As long as your bump is under that water, it really helps to relax the body. It helps you to relax your muscles, the warmth and the moisture. It's kind of like being in a spa in a weird way. Just trust me on this one. I used to think there's absolutely no way. And then I went to go and work in a birth unit, and I would say around 90% of the births I helped facilitate in that unit were in water. And I came back to Coventry almost 3 years ago, a completely changed midwife, because what I saw and experienced in that birth centre was just mind-blowing. Like I said, as long as your bump is under the water, it is a really effective pain relief option. Now you can use, like I said, the gas and air in the water as well. That is plumbed into the birth room, the pool room, sorry, there, and also over on Lucina. The picture there is the one that we have on labour ward. Okay, so the pools themselves are really large. Your birthing partners are welcome to get in the pool with you as well if they want to. That's absolutely fine. There are different ledges and steps in the pool itself. So it's good because you can maneuver into good positions and actually use those steps, use the ledges to prop yourself up. When you're in water, obviously you're buoyant, you're weightless. So it's really nice for your joints, it's nice for your hips. And as I said, you can maneuver yourself into birthing positions much more easier in the water than when you're on dry land. Okay, if your birthing partner chooses to get in there with you, like I said, that's absolutely fine if they want to, but please bring in some swimwear. For ladies themselves, you guys can wear really whatever you want to. A lot of ladies will rock up with like a bikini. By the time baby's born, they essentially have nothing on. That's fine. The rooms are very private. Nobody's allowed to enter the rooms without your permission. So if somebody knocks on the door, the midwife will go see what's going on, who that is, and then obviously we will then come back, relay that information to you. And if you feel comfortable and happy for someone to enter the room, then they will then enter. People don't just walk in and out of the rooms. Okay, it's a very private area. So you know, if you wanted to not wear anything in the pool, that's fine. If you're feeling a bit self-conscious, again, please don't worry. That will just be you guys and your birthing partners and us in that room. So yeah, just feel comfortable, and obviously we will police that, not let people in the room, so it's fine, I promise. As I said, it is just warm water. We check the temperature of that water every hour and then top it up accordingly. When babies are born in the water, it's quite a nice transition for them because they've gone from being in water inside of your tummy to then just sort of being born into warm water. It's like a natural environment for them. We would actively encourage you to lift your baby out of the water during a pool birth once you've given birth. As a midwife, we stand away, we're hands off. We don't want to stimulate your baby in the water, so we hands off. We will use a mirror so we can see what's going on, but essentially we just leave you to it in the pool. And I think it's really nice because it just gives you that sense of like, not control, because I don't know, that's a bit of a harsh word, I think, but just an overall sense of it. Well, it is control, really. You are in control of your birth. You have your caregiver there on the sidelines, but we don't jump in. We definitely don't get in that pool with you. So it's nice in terms of having that space, especially if your birthing partner wants to get in there too. It's like it's a really intimate environment to be in. Again, we can dim the lights down, put the twinkly lights on, and put the stars on the ceiling for you. We can use some nice music. We would actively encourage you to think about hypnobirthing and breathing techniques when you're in the water. Again, these work as a pain relief option, and it sort of just goes hand in hand together, water birth and sort of hypnobirthing. It's just a really calming environment. So that's what happens with regards to a pain relief and the water birth. I do have a water birth workshop that you can access that goes into a bit more detail about water birth and what it looks like and how that all occurs. You just check that out on our Eventbrite, and it's an hour and a half worth of information with regards to water birth, but it is essentially a pain relief option as well. And then we have our most invasive pain relief option, which, as you can see in the bottom picture there on the left, is that's actually an epidural. So an epidural would only be placed by an anaesthetist. That is a doctor who is trained in anaesthetics, so pain relief. And this is only ever done on labour ward. So if you were, for example, on Lucina and you said, you know what, I want an epidural, what we would do is we would transfer you to labour ward, and the midwife would go with you to labour ward. The same midwife would follow you through to labour ward and then commence treatment and care on labour ward. Because of all the monitoring and the extra interventions with an epidural, it's not safe for you to stay on Lucina. So that's why we would need to move you. So essentially what an epidural is catheter tubing that's placed into the epidural space in your back. The way they do it is they give you a one-time injection called a local anaesthetic into the back. That numbs the area, so you don't feel anything sharp, but you will feel a bit of pressure and prodding, okay? When they are happy that the local anaesthetic is working, they then use a longer needle called an epidural needle, and that's when they go into the back with the needle and they find the epidural space. They never go too far. They never penetrate that needle too far. It's going to cause any permanent damage. We've heard that before quite a few times. I do get asked that quite regularly. Will I have permanent damage to my back? My friend's got, long-standing chronic back pain because she had an epidural. It's not the epidural that's caused that. It's actually the weight of carrying that baby and the pressure that it's the damage from that, really. So we would encourage you to work on your core muscles for that, but it's never the epidural. The epidural doesn't cause any long-standing damage or chronic damage to your back to cause back pain and stuff like that. So just to bear that in mind. So what they do, like I said, is they use the needle. They find the epidural space, and then what they do is they feed a catheter tubing, so it's a thin plastic tube through the epidural needle. When they're happy that's in the right place, the needle itself comes away, so you're not left with any needles in your back. It's purely just plastic tubing. That is then attached to a pump, and the medication goes through that directly to the epidural space. What that means and what that does, how you will feel, is you will basically go numb from the waist down. So you will not be able to get up and walk around to go to the toilet, etc., etc. So it can limit your birthing positions. But like I said, the beds are electric, so we can hopefully help to manipulate the beds to get you into better positions if you feel comfortable and strong enough to do so. But also it means that you won't be able to get up to go to the bathroom. So what that means is we would usually recommend a catheter. So again, this is a thin tube that goes into the bladder, and then that drains the urine into a bag, and then obviously we empty the bag. Okay. Also, just to point out that the medication for an epidural, that can cause your blood pressure to drop. Okay. If your blood pressure gets too low, you're at risk of passing out. Basically, it's not a good thing. So what we would do is give you medication, give you fluid to counteract that. So that would mean needing a cannula, so a tube that goes into your hand, and then a drip, basically. So just important that you think about these extra things, because sometimes, we get women coming in and they say, oh, I really want an epidural, but they don't realise that it also then requires a catheter and a cannula, and it means X, Y, and Z. So it's just about having a better understanding. Now, an epidural, it's really effective, and the majority of women, they love them. They tend to just sort of fall asleep. But when you come to birthing your baby, because you won't feel the contractions, the midwife will have to tell you when it's time to start pushing, and we'll tell you when it's time to actually push. So we will coach you through it, but essentially you won't feel when you need to push, so we will have to tell you. Now, because of that, it can affect the way the way that you push, and it can also affect how well you're pushing. So that can actually prolong your second stage of labour, and in turn that can then increase the risk of interventions such as forceps, such as a ventouse or vacuum delivery, and then also in turn cesarean section. Okay, so it does raise or increase the risk of needing those interventions. So again, it's just important to understand what an epidural is, the pros and the cons, and whether this would work for you. Okay, again, this is a really personal decision to make, and I want you to go away and do reading or read up about this. And like I said at the very beginning, knowledge really is power. The more information you can get, hopefully the more confident you will feel with your choices. So do go and do some more reading up with regards to pain relief options, what this looks like, what that looks like, what this could potentially mean, and then include this all of this stuff sort of into your birthing plan, and then, like I said, bring that in with you. So cesarean section, this is what essentially it looks like. So a cesarean section, it is a major operation. It is not something that we do just for fun. Okay, it really basically is to save mum's life or save baby's life. Okay, you are allowed to have one birthing partner in theatre with you if you are awake. The majority of cesarean sections occur when mum is awake. For some cases, it might mean that we would need to put you to sleep in emergency cases, but the majority of women will be awake and they can have one birthing partner. If for any reason you need a general anaesthetic, so to be put to sleep, unfortunately you are not allowed any birthing partners in the room with you. What we would do is ask your birthing partner to wait around in the recovery room, and once baby is born, then obviously we will come and tell your birthing partner that your baby is born, and then once you are awake, we will bring you round to recovery, and then you'll be reunited in recovery altogether. But like I said, the majority of ladies are awake for cesarean section. So what happens is you'd go to theatre, the anaesthetist would be with you as well, and they would give you essentially a one-time injection into your back. This is called a spinal injection, and again, it makes you numb from, again, the waist down. And when I say numb, I mean completely numb. I've had 3 cesarean sections, so I can speak from experience. It's the weirdest feeling, and it works really quickly, sort of within 30 seconds after they've done the injection. Yeah, you're numb from the waist down. As you can see in the picture there, it looks quite busy, doesn't it? So the people in the room itself, the people at the very end of the bed, those are the theatre staff. So they are there to sort of write things down, pass equipment, write things on the boards, like I said. That is their domain. They are brilliant. They are the theatre staff, and they just sort of keep things running smoothly. They're wonderful, but they tend to stay down that end of the bed. Okay, they will introduce themselves, but they tend to stay that end of the bed. The blue sheet here, you can see, is usually actually higher up. and that acts as a screen. So basically it's like a privacy screen, so you can't see anything. But the two people either side of that, they are your surgeons. Now the surgeons are the same doctors that we have on labour ward, so you will have met them prior to a cesarean section. It just might mean that because they're all gowned up now, they've got their gowns and the masks and everything on, you might not recognise them. You might be thinking, why? How do they know so much about me? They're being quite friendly with me, which is good. But it's because they already know you. They will have met you in the room. It just, like I said, you might not recognise that it's them because of how they're dressed, but they are the same doctors. You then will have, like I said, the anaesthetists. They will be stood there on your left hand side, and then what we would do is we would put a stool next to your head on the right hand side, and your birthing partner will be asked to sit there. Again, they will also be provided with a lovely pair of scrubs to put on and a nice hat, and then yeah, we would ask them to sit there next to you. If you wanted us to lower the screen itself once baby's born, like in the picture here, please do ask. It depends really on who your surgeon is on the day as to whether they feel comfortable doing so, but if they are happy to do so, then absolutely they will lower it down so you can sort of see baby like this. What we do with regards to delayed cord clamping that Marley spoke about in the video, what we would do in theatre is we don't leave the cord for too long. We actually start a timer, and after 1 minute, the surgeons will then clamp and cut that cord. Reason being is because theatre is quite cold, okay? So we don't want baby to get cold. When they're born, they're wet because they've been inside in water. They can become quite cold quite quickly, and that's a whole other yeah, it's like a triangle effect that affects the babies, like their feeding and their blood sugar levels, and they can become quite poorly quite quickly when they become cold. So they don't like to leave baby exposed for that long. And also they want to start to suture mum up as soon as possible to reduce the risk of infection. So 1 minute, they will allow the blood to go back to baby, and then they will clamp and cut the cord. They will then pass the baby over to the midwife. Now the midwife will be the same midwife who's been with you on labour ward. We just chip off for like 5 minutes to get changed quickly, and then we will reappear in theatre. And we sort of just linger around waiting for baby to be born. When little one, they've clamped and cut the cord, they will pass the baby over to the midwife, and then we will bring baby to you. We will put baby down your gown if you want us to, so we can facilitate some skin to skin contact. That's absolutely fine, as long as you feel comfortable doing so and your baby feels comfortable. Well, you don't know baby's feeling comfortable, but baby's healthy enough to do so as well. Obviously, if baby required any sort of interventions, it might be that we just take the baby off. Sometimes babies, especially cesarean section babies, can be a little bit mucousy. Sometimes they just need their airways clearing a little bit, or a little bit of assistance with oxygen sometimes, in which case once the baby was happy and had all pinked up and was all perky, then we would bring baby back to mum and then put her or him down your gown. That's absolutely fine. If you would prefer to wait till we go to recovery, that also is fine. What we would do is transfer you when you are ready to go to recovery, sit you up, and then we can put baby down your gown and facilitate that skin to skin contact. Then we do like your breastfeeding, all that sort of stuff. We will also take photos for you if you want us to. That's absolutely fine. And again, we have a stereo in there too. So if there's a specific song you want your baby to be born to, just let us know and we will do that for you too. Usually it's 1 night in hospital and then you can go home, and that's the same as a normal birth as well. Usually 1 night in hospital and then you go home the following day, and we'll talk a bit more next week about what happens actually on the postnatal ward, but that's a general overview of cesarean section. Now, as with any operation, there are always going to be risks involved there. So as you can see on the screen, the risks include infection, blood clots, damage to nearby areas such as your bladder, and pain and bleeding, okay? But your team are all there with you, and actually if there was to be any bleeding, they just deal with it there and then. And actually a lot of the time women don't even realise that it's actually been a bit of an issue until afterwards when we speak to you on the postnatal ward. So it's all dealt with very calmly and immediately, because your team are there with you. Now the scars themselves, as you can see in the picture, okay, they are quite low down, below the pubic line. They're around 10 centimetres in length, and they start off quite aggressive looking. They can be quite purple, red, yeah, like a little bit irritated looking. Eventually, as time goes on, they do flatten and they do become lighter in colour. Eventually, they will turn into that normal sort of silvery scar-like colour. But we thought it was a nice idea just to show you little pictures there, so you can sort of get an idea of what to expect should you require cesarean section. And again, just like water birth, we do have cesarean section workshops that are available on our Eventbrite if you want to learn a little bit more about cesarean section, but that's just a general short overview there of what happens in theatre. So when should you seek help? Here we go. So when your waters break, or you think your waters are broken, please seek help. If there's any bleeding in pregnancy whatsoever, please let us know. If you have any reduced movements, and actually I just want to say, even if you have increased movements, any change in movements at all needs to be looked at. Okay, babies, when they are tired, they're not feeling great, if they're a little bit distressed, they will sort of show us that they are whilst you're pregnant, so in utero, by changing their movements. Sometimes they sort of have a flurry of movements and then they go a little bit quiet. Sometimes they just go quiet because what they're trying to do is conserve their energy. So any change in movements needs to be investigated ASAP. So please let us know. If you are experiencing strong regular contractions, or if you just have any concerns at all, like I said, please do call us, phone triage. We are there 24 hours a day, 7 days a week. Now, if you are phoning and we're not answering the phone, it's not because we're not there, it's just because we're really busy. If you know you need to be seen, please don't sit at home and stress out about it. Just make your way in. Yes, it's nice for us to know that you're on your way in, and sometimes we can actually save you a trip by assessing you over the phone. But you know, if we're not answering the phone, just make your way in. Don't sit at home and worry about things. That's the last thing we want you to do. You're never a hindrance or a burden. We are literally there to look after you and your baby. So if you do need anything, you need help, just come into triage and we will see you accordingly. Now, what we would usually do at this stage is I would show you this induction of labour video, which basically goes through the induction of labour process. It will talk a bit more about pain relief options, your birth choices, and I think a little bit about monitoring, but it's 8:30. So I'm going to give you some homework. Please, between this week and next week, if you have got 10 minutes free, check out the induction of labour video. It's included on that email that I sent you at the very beginning before the class started. And like I said, it's going to just sort of tie in everything we've spoke about today, but sort of a bit more of a visual representation, let's say. This lady here had an induction of labour with us in 2019. Then obviously COVID happened, so things changed, but now we are back to pre-COVID recommendation. So do check the video out, please, if you get a chance. Like I said, it's going to just give you a bit more information and just tie up everything we spoke about today. I can appreciate that's been a little bit chaotic, hasn't it? Thank you for sticking with me. So next week, what we're going to do is we will talk through what happens after birth. So start off talking about the golden hour. So what happens literally immediately in the postnatal period, what happens there. We'll talk about baby brain development. We'll talk about infant feeding, hand expressing. We'll talk about your pelvic floor, some mental health stuff, and we will talk about changing baby's nappy and keeping the umbilical cord clean and dry and infection free. And also I'll explain to you what happens when you go home and when the midwives come to see you at home. So please do join me next week, same time, same place. I will send the invites out. I will do that now, actually, so you've all got it. But like I said, if you do have any questions between now and then, please do feel free to reach out, and I'll do my best to get back to you. If I don't know the answer to something, I'll go and find it out and I will get back to you. But like I said, thank you for listening. I hope you've learned something, and I will see you all next week. Oh, there's a question. Let me just see what the question is. Question is, hold on, let me scroll down. How to avoid tears during pregnancy, second or higher degrees? Does assisted delivery increase the chance of tears or episiotomy? Good question. Okay, so how to avoid tears during pregnancy. When you birth baby, there is actually, wait, I do have let me open up another. I have got a slide actually that will show you a little bit. Hold on a minute, let me do this. I'm gonna just stop that. So hold